Acting Deputy President.
Senator Waters.
Thanks very much, Mr Acting Deputy President. I rise today to talk about women's rights. And sadly, in 2016, as we all know, we still do not have gender equality. We don't have equal representation in our parliaments or in our business community for that matter. We still don't have equal pay, with the gender pay gap still being above 17%. We have huge gaps in our retirement incomes when it comes to that stage of our life. We still do the bulk of unpaid domestic work in the home, and one in three of us still face horrific domestic violence in this day and age. Now, I've spoken about these issues in the chamber many times before, and there are many women and men from all political parties who are working on these issues, and I commend them for that. Today I want to focus on a woman's rights over her own body. Last month, as many listeners would know, was the 10-year anniversary of RU486, the medical abortion drug, being made available. Now, in February 2006, this parliament passed those laws that took away the ministerial veto on importing RU486. It was from the Health Minister, and it was of course Mr Tony Abbott who held that position at the time. And one of the most famous catch cries of that campaign was, "Get your rosaries off my ovaries." Today I want to pay tribute to the women in federal parliament from all political parties who worked on that issue and who united across party lines to get that reform through. Some of them are still with us, others have moved on to other careers. So that bill came about via cooperation from many tremendous women, including then Green Senator Kerry Nettle, then Democrats Senator Lynn Allison, from the Labor Party, then Shadow Health Minister Julia Gillard, of course, later the Prime Minister, Senators Jan McLucas and Claire Moore from this chamber, who still hold those positions, and Liberal MP Dr Sharman Stone, and then Ministers Helen Coonan and Kay Patterson. It shows that when we work together, we can get things done, and I think we should all reflect on that, given that we have such huge challenges left in gender issues, sadly, in this day and age. I want to also give credit and thanks to Dr Carolyn DaCosta, who is a very well-known obstetrician and gynaecologist who first stuck her neck out to apply for TGA permission to access RU486, and was really the woman who started off this campaign. She remains a fierce advocate for women's rights, and she remains a medical practitioner in my state of Queensland, and I want to thank and commend her efforts over so many years, and wish her many more successes and wins. That's the sort of brave stand that we clearly need to take in Queensland, because sadly in Queensland abortion is still a crime. It is listed in our criminal code. That's also the case in New South Wales. These antiquated criminal laws, in Queensland's case they were written in the 1800s, still say that a woman does not have the right over her own body because abortion is considered a crime. It is long past time when we changed those archaic laws. Now, because of the rules in those utterly outdated and repugnant laws in Queensland, a woman needs to be able to establish that her physical or mental health are seriously in danger from continuing the pregnancy. So she needs to find a doctor who will say that her mental health or her physical health is in serious danger were she to continue with the pregnancy. That is the only way in which an abortion can be legally performed in Queensland. Now, obviously that's a huge barrier for the medical community, because the legal uncertainty is a real, has a very chilling effect on doctors who want to be able to provide patient care and want to be able to empower women, and sadly those laws are really casting a pall over that. The combination of those outdated laws and the almost complete absence of publicly available pregnancy terminations makes it expensive and really hard to access. From the data that we do have, and it's not perfect, we know that the vast majority of abortions in Queensland are performed in private clinics. It's about 99% versus just 1% in the public system. So that means that women are facing enormous costs. And depending on how far along they are in their pregnancy and whether they're able to access a termination, it can cost up to $1,000. Now, many Queensland women don't have a spare $1,000 to have control over their own bodies, and healthcare should be a universal entitlement, not a privilege for those that can afford it. Now, of course, in terms of the availability of those clinics outside of the southeast corner, there's only clinics on the coastline. There are no clinics available for non-coastal Queensland women. Now, that means, for example, that women in Mount Isa have to travel to Rockhampton, which is miles away, to access a termination. Now, I believe that the state should not have control over women's bodies, and that the provision of pregnancy termination should be safe, should be legal, and it should be accessible and affordable. So we clearly need to take that first step in Queensland and decriminalise abortion, and then we need to move on to make sure that it's safe, legal and affordable. And now this is a position that many Queenslanders agree with. The last survey that was conducted was in 2009, and it was of about 1,000 people in Queensland, and almost 80% of those agreed that abortion should not be a crime. The law should be changed so that abortion was no longer a crime in Queensland. Now, in order to do that, of course, we need to change the criminal code in Queensland. We would need Queensland state MPs, perhaps with some influence from their federal counterparts, to vote to update those laws. There's obviously some concern that if we open that can of worms, the rights could be even further restricted, and nobody wants to see that happen. But I don't think that's a valid excuse for doing nothing or for staying quiet, which sadly has been the case for too long. We need a public campaign to restore women's rights over their own bodies and to update those incredibly archaic criminal laws which say that in Queensland abortion is a crime. Now, I wrote to Queensland MPs, we've got 89 of those in our state parliament. I wrote to them late last year and asked them what their position was on this issue and whether they would be prepared to talk to their constituents and to support changing our criminal laws to empower women over their own bodies. Now, unfortunately, I haven't had a response from everyone, and I will send yet another follow-up letter to chase them. But of the folk that I've heard back from, 8 of those support decriminalising abortion. 4 of them oppose it. 6 of them didn't really make their position clear in their response, and 71 of them I've not heard back from, and they've not gone on the public record to make it clear what their position is. So I want to thank those MPs that have spoken out on this issue. Clearly we need more to do so, and I would urge the members of Queensland's Liberal National Party to allow their members a free vote on this issue. My understanding is that that's not the case. When you've got nearly a third of women in Australia who will seek an abortion over their lifetime, it is about time that our laws reflected modern values that trust and empower women to make decisions about their own bodies. As I've said, abortion should be decriminalised, and more than that, it should be safe, it should be legal and it should be affordable. There's also the issue of unbiased pregnancy counselling, and that's something that this place could do a lot more to try to remedy. There are sadly often anti-abortion organisations who pose as unbiased pregnancy counselling services and yet then funnel women away from advice about the full spectrum of their options. That's clearly something we need to do more on, and I look forward to carrying on the work of former senators, in particular Senator Natasha Stott-Despoja, who begun some work in that area. We of course still have anti-choice protesters outside abortion clinics harassing women as they enter to make what is probably the most difficult decision of their life, and in a way that impinges their dignity and their safety and their privacy. Now, I commend many of the state jurisdictions who are now implementing exclusion zones around abortion clinics. The Greens are the biggest champions for the right to protest. When it comes to medical privacy, there needs to be an exclusion zone around those abortion clinics. So 10 years ago, we made good progress on women's reproductive rights in this place by working together across party lines. We sadly still have a long way to go, but I really look forward to carrying on that work and building now on the work federally to update our state parliaments and those criminal laws that unfathomably make a woman's control over her own body something that's a question for the state and the Crimes Act.
Senator